House Bill 74, Delegate Guyton, and you have, I know, a panel, and some of those you have Ann Geddes here, and then you have 3 individuals that should be with us virtually. So I'll let you begin.
You have heard this bill before, House Bill 74, under a different number. I am, for the record, Delegate Michelle Guyton. I represent Baltimore County, District 42B, and I am happy to present this bill to you again with a few minor changes. Well, maybe not so minor. I'm not going to spend time trying to convince this committee that mental health supports and health supports are necessary in our school. In my district, in your district, all over the state, we hear students, teachers, and parents literally begging and screaming for these kind of supports. So we all know this, and I know this committee is very intelligent about that sort of thing, having education under your purview. So I'm not going to go into that. I do want to say that I personally and professionally have been trying to improve the mental health supports in our schools for over 18 years in different capacities. And seeing what we're going through now, increase in suicides, increase in aggressive behavior, increase in teachers really asking us and crying out for supports. Now I hope is the time that we can finally do something substantive to address this problem and to address it very directly. Now, so this is my gift to you, right? Is HB 74, I believe, is that program, but it falls into some great categories. It's an optional program for our schools. This is a program that actually establishes what we call a Lifesaver Schools Program and designation in Baltimore, in Maryland state schools, in public schools, right? This is very similar to the Green Schools Initiative that many of us know about. And schools have been involved in that and are very, very proud of their participation in that particular program. I know that this committee also passed a Purple School program, Purple Ribbon School program that I believe was introduced by our colleague Delegate Patterson last year, and I certainly support that as well. These are programs schools are proud of. My elementary school has a big banner out front saying we are a green school, and a lot of kids and teachers and staff benefit from these type of programs. This one takes this a step further because House Bill 74 is an optional program. It has no significant fiscal note at all. If you look at, and that's important this year, right? And every year, no significant opposition. There are a few folks, like there always are, particularly in my other committee, that put their name there, say we're unfavorable, but give no contact information and no real reason for opposition. We got a few of those, but no significant opposition and a whole lot of support for this bill. So I do want to direct you to that list of supporters, which are very, very strong. The program recognizes schools for additional investments beyond what we're already doing through COMAR and through Maryland State Department of Education regulations in student health and mental health wellness. It's as simple as that. To earn the designation, a school is required to provide students and staff members, so not just one or the other, provide them the opportunity to train in first aid and CPR along, and this is my favorite part of the bill, with either a mental health wellness program and or a peer mentoring program. And we do have many, many of those available through the Department of Education at no cost to these schools and to these districts. Yeah. And we know that they work. They're all evidence-based programs that make a difference. Schools must also provide students service hours for this. So that's another incentive. And incentives were one thing that Delegate Ebersol asked us to add to the bill from last year. And the students are always scrambling for ways to get those service hours. So we're hoping they can get them through these programs, helping themselves and their fellow students in their school. And then schools also, the program will be administered by MSD, similar to the Green Schools program. We've already talked about that. The changes in addition to the incentive for students, and I want to thank Delegate Ebersol for his leadership on this, Delegate Pasteur, who's actually not on this committee, but I've got to give her a shout out publicly for her help from a teacher's perspective as well. And the Maryland State Education Association, who is favorable on this bill, for introducing an amendment that made it really helpful for them as well. So I couldn't have gotten it to this point with these changes without all of those folks. So thank you. The amendments that are not in the bill before you, but that are already submitted to the committee and you should have in front of you are two that I just talked about. We authorize school personnel to participate in the professional development related to this bill during school hours, earn additional compensation for participation, or receive continuing education credits for participating, which is also very valuable to them, right? And then this is directly from Delegate Ebersol. Once every 4 years, the Lifesaver School is required to reapply to the department for distinction, to maintain their distinction and to ensure that they are still participating. So for all the reasons I've already spoken about, and because we all know that this is an important issue, I'm hoping that we will get a favorable report on this bill this year, House Bill 74.
Thank you. And is Ann Geddes here in person? Yes, please come up and you will have 2 minutes to testify when you begin. Thank you.
Thank you, Madam Chair and committee members. My name is Ann Geddes. I'm the Director of I'm the Director of Child and Older Adult Policy at Mental Health Association of Maryland. MHAMD is a nonprofit mental health education and advocacy organization. Thank you for the opportunity to testify in support of House Bill 74 today. House Bill 74 lists several components that a school would need to fulfill in order to be identified as a lifesaver school. I wish here to speak to the critical importance of schools promoting mental wellness. The mental health of young people has deteriorated dramatically over the last decade, which was fueled in part by the pandemic, but there was a very negative trend even prior to the pandemic. Data from the Youth Risk Behavioral Survey for Maryland students shows that in 2021, 29% of high school students and 23% of middle school students reported that their mental health was not good most of the time or all of the time. These percentages are alarmingly high. Promoting youth mental wellness in schools is one important way to address this troubling trend, and it has a strong evidence base. It is the #1 recommendation of the U.S. Department of Education to tackle the issue of student mental health. Schools that go above and beyond to support student mental wellness deserve recognition, and this can encourage other schools to do the same. Therefore, we urge a favorable report on House Bill 74. Thank you.
Thank you. Next, we will switch to the folks that are with us virtually on the panel, and we will start for 2 minutes with Maya Tarantino, please.
Hi, good afternoon. I am Maya Tarantino, a senior from Delaney High School in Baltimore County, Maryland. I have 2 perspectives to share with you today in supporting HB 74. My first being the emphasis on mental health education in schools. Suicide is the second leading cause of death in teens ages 15 to 19, a devastating statistic. Devastating is being 17 years old and having witnessed the loss of 4 peers to death by suicide in my high school years alone. As a Maryland public school system student, I've witnessed firsthand the importance of mental health education in protecting our youth. There has been a severe lack of education and training within school buildings in time of social and emotional crisis. Students are taking this issue into their own hands and are working to create change within their buildings. At school, I started the club Not on Our Watch, an advocacy group to put an end to the crisis we have faced thus far. I speak for all 50 of our members when I say students are eager to continue making this change, and through the Lifesaver School Program, excited to be recognized for all the work they've done already. My second perspective for you is not as a mental health advocate, but as a student athlete, favoring CPR and first aid training in schools. As a student athlete, I understand the importance of having well-trained personnel in times of physical distress. While we often hope serious injuries don't occur during sports games, our Baltimore County community has seen firsthand the importance of CPR training. In 2021, a Loyola High lacrosse player and peer of mine, Peter Lake, was hit in the chest by a shot and went into commotio cordis, blunt trauma to the heart. While the team had trained professionals to perform CPR and resuscitate him in the game, this left the question of what could happen when students play on their own time. Whether it be pickup after school or captain's practices, we need to ensure athletes are prepared and have the training needed to mitigate harm until professionals arrive. In a time that experts are calling a mental health epidemic and sports injuries are on the rise, this is a no-cost solution aimed at saving lives and enriching our education. On behalf of all students, I ask you to show your support and help in ensuring no more lives are lost at the hands of our education system. Not on our watch. Thank you for your time.
Thank you. Next, William Flook for 2 minutes, please.
Good afternoon. Thank you. My name is Dr. Bill Fluke. I'm a retired school psychologist. Over the past 50 years, I've devoted my career to addressing the mental and behavioral health needs of children in school. I'm speaking today for the Maryland School Psychologists Association in strong support of House Bill 74. As you've heard, the Lifesaver Schools Program would promote health and wellness in our schools, both physical and behavioral. In order for all students to succeed academically in school, it's essential that we address these elements as well as the traditional 3 R's. In particular, our children cannot reach their academic potential without a foundation of good behavioral health. This bill encourages schools to promote mental health, wellness, and peer mentoring. It's well crafted to enable community involvement, and it offers incentives for teacher participation in the form of professional development credits. More importantly, at a time when the media seem to wallow in every little bit of bad news out there about our schools, this bill will help participating schools boost pride in their schools among students, parents, and staff, and in the community at large. House Bill 74 adds an important element to existing statewide school recognition programs. Blue ribbon schools are recognized for their academic achievements. Green schools emphasize environmental education. The new Purple Star Schools program recognizes schools which support military families, such as the one where I served in Fort Meade in the 1980s. This proposed Lifesaver Schools program opens the door to many more schools achieving recognition for and pride in their accomplishments in this vital area, and I urge its passage this session. Thank you.
Thank you. Next, Laura Stewart, please, for 2 minutes.
Thank you for having me. My name is Laura Stewart, and I am with Free State PTA. We represent over 70,000 volunteer members and families in over 500 public schools. As the state's premier and largest child advocacy organization, Free State PTA has a powerful voice for all children, a relevant resource for families, schools, and communities, and a strong advocate for public education. We are here to ask for a favorable report on House Bill 74. This bill aligns with our principles for legislative action, which states that schools must provide a safe environment where all students, teachers, and staff can thrive. In alignment with our principles for legislative action, implementing inclusive, I'm sorry, I got a little confused, just a second. Okay, this bill establishes the Lifesaver Schools Program to recognize public schools that have health and safety training to students and school personnel. Students would be empowered through education to step in at any time to help or save a friend or a loved one, and staff who would have the tools to keep all kids safe in their classrooms or at school activities and athletic events. It was important to PTA members that this bill would not create an unfunded mandate. So we are pleased that it is an incentive to provide education and resources in an innovative fashion. Recognizing schools with this designation would also help parents and students understand that their school prioritizes safety, considering the increase in the need for mental health services and the increasing rates of suicide for all youth, but especially in youth of color and LGBTQ+ youth. Training suicide prevention could save lives and possibly reduce these inequities. Free State PTA believes this bill is vital in ensuring the well-being of children and therefore strongly urges that this committee issues a favorable report on this bill. Thank you.
Thank you. Are there any questions for Delegate Guyton or any member of her panel? Delegate Patterson.
On.
All right. Thank you again. Thank you, Madam Chair. And thank you, Delegate Guyton, for bringing this legislation to our attention. It's interesting that there are some community groups who are working closely with communities regarding the increased number of suicide. For example, Alpha Kappa Alpha Sorority Incorporated has identified, as well as the Links Incorporated, identified the increased numbers of African-American students who are who have attempted or who have committed suicide. So the idea of this Lifesaver program is one that I'm really intrigued about. My question is this, can you cite a model of a program that's already in existence, or is this a new program that has been created?
Yeah, thank you so much for that question. Without going into too many details, as you know, I'm out to do. There was a needs assessment by the State Board of Education several years ago that I was involved with, where we went to every county to see what free resources were in the counties available to schools and students, and what free resources were at the state level available to schools and students. And part of that initiative also was to make sure that those resources were broadly broadcasted and on the website of MSDE. So there are a long list of these sort of free resources that are all evidence-based, that are already available to students and to teachers and to schools and to parents and communities, but they're really being underutilized, right? And there's so many terrific programs, and I would do mental health first aid is one of the first ones that come to mind. And there's also a student version of that, but many people don't know about that. And so there's not the incentive necessarily or the ease of usage in the schools right now for people to be able to take advantage of those programs the way that they should be, because they really are helpful. And so that's what this program is trying to do. Bring it to people where they are and incentivize them for doing it.
Thank you. It's really needed.
Thank you
again.
so much, Delegate Patterson.
Delegate Miller.
Thank you, Madam Chair. And thank you, Delegate Guyton, for bringing this forward. I completely support it. It is so needed because not only is it part of the school community, then that school is the community. So the more people that you have certified in CPR, the more people that know about, mental health aspects, they are going forward and being leaders in their community and being able to provide those services. So I completely applaud you for this. So a couple questions. When you're talking in a school environment, how many people have to be certified as far as teachers, not coaches? That's a little bit separate. So if they're not a coach, how many people in your average, either elementary school, middle school, or high school by law need to be certified in CPR for safety?
In CPR,
Or
under
first
current
aid.
statute,
Yes, current.
I'm not
statute.
sure the exact numbers. There are people that need to be certified.
But yeah,
but
it's
I
very
don't
few.
have the
Yeah,
exact
if you could get that, because I think it's very, very few from what I remember and what I recall. And so for having this, tying it into the professional development piece is critically important. So that will, like you said, incentivize people to do it. But it's very, very low. And when you have a school that's 1,500 students, it's very concerning for not to have more requirements of this. So completely support you, completely support the bill. If you have any insight into that, I'd appreciate it. Thank you so much.
Any further questions for this panel? Okay, seeing none, thank you very much. Next, I will call Miss Cohen, Miss Carter, and Miss Carter. And whoever would like to go first for 2 minutes, go ahead and start.
Okay. Madam Chair, Madam Vice Chair, members of the committee, my name's Ellie Cowan. I'm here today on behalf of the National Alliance of Mental Illness Maryland in support of HB 74. NAMI Maryland is a nonprofit that is dedicated to providing education, support, and advocacy for persons with mental illnesses, their families, and the wider community. We echo our support for this legislation for all of the reasons enumerated. We applaud Delegate Guyton for encouraging schools to offer this type of programming to educate on mental wellness and/or peer mentoring. NAMI Maryland encourages the utilization of free NAMI programming, including family-to-family, peer-to-peer, NAMI Basics, and NAMI Ending the Silence, which is designed specifically for middle and high school students, school staff, and parents or guardians to teach about the signs and symptoms of mental health conditions and how to recognize early warning signs and the importance of acknowledging those warning signs. You've heard a lot about the value of this programming, this type of programming in schools, but I think in this budget year, it's worth mentioning again that all of this can be accomplished with existing resources, so revenues are not affected. And I know we're in a tight budget year, so programs like this that already have a funding source are added, have an added bonus there. So for all those reasons, we urge a favorable report. Thank you.
Thank you. Either Ms. Carter.
Dear committee members, my name is Laura Carter, and I'm currently a 9th grader in Glen Oak High School enrolled in Health 1. I'm coming before you today to share a personal experience that emphasizes the urgent need for the implementation of the Lifesaver School Program proposed in HB 74. 2 years ago, while I was still at Glenwood Middle School, 2 students had seizures within a single week. The lack of preparedness among the immediate staff during one of these incidents shows the necessity for comprehensive training in handling emergencies. During a seizure incident that took place during recess, the initial response from the staff was not enough. Without the presence of a trained professional, the recess monitors struggled to take appropriate action. In a moment of crisis, their solution was to place a jacket on the convulsing student. It wasn't until the nurse arrived 6 minutes later that proper measures were taken, setting the student's head to the side and placing the jacket underneath to prevent choking or head injury. This incident shows that relying solely on the nurse for emergency situations is not enough. While my Health 1 class covers some aspects of first aid, including the use of a tourniquet, AED, and chest compressions, it falls short in addressing the wide range of potential medical emergencies. First aid training should extend beyond these basics, preparing students and staff for various scenarios they may encounter. The time it takes for someone trained to reach a medical emergency can be crucial, and every second without immediate first aid increases the risk of more serious harm. The kids didn't know what was going on. They were panicking and confused. One of the students knew it was a seizure and told us after. First aid training can ensure that both students and staff are well informed about emergency procedures, reducing confusion and panic. In the future, I may be the only one around in an emergency. I want to be more prepared to help someone. The Lifesaver bill would also help with mental health in the school. A lot of students and even myself struggled during COVID. I felt lonely and isolated. It took a while to get back to my social living during COVID. I felt awkward and out of practice. So my friends really struggled with depression. The thing that got us through it is each other. Whenever my friends are struggling, they talk to their close friends. They don't talk to adults. A peer mentorship program would help high schoolers to be more comfortable talking about mental health and getting the help they need. Offering training in schools with an added incentive accounting towards service hours could slightly increase enrollment. Imagine the positive impact if a large number of students and staff were empowered to help each other in a mental health and emergency situation. We can create a safer school environment. It's time to empower our school communities to act confidently in the face of emergencies that many of us will face.
My name is Kathleen Carter. I am a vision and health advocate who's worked for the last 8 years to improve the health of our community and our schools. I appear to you today not only as an advocate, but as a concerned parent, urging your support for HB 74 Lifesaver Schools Program. The program aims to recognize schools that prioritize the mental wellness of their students and staff by implementing mental health and peer mentorship programming, as well as CPR and first aid, and then they renew it every 4 years. I believe many of us present here have encountered the challenges of supporting loved ones dealing with depression and suicidal thoughts. Personally, I experienced a traumatic incident in high school when I had to rush someone I cared about and loved to the hospital after a suicide attempt. This heartbreaking experience left me feeling powerless, questioning if there was more I could have done, and burdened with self-blame. Today, our schools and communities grapple with mental health crisis, and students and teachers are calling for resources to address the pressing need to prevent suicides. The PBS News just had a report this week about student-led networks helping to address the shortage of mental health professionals in schools. The report featured a peer-to-peer suicide prevention program that reduces the risk of youth suicide through education, training, and peer intervention. The program is found in over 1,600 schools and 43 states. Maryland is not one of them. One of the student members interviewed said, and I found this so poignant, students are like the ears and eyes of the school. We bridge the gap between students and counselors and teachers. After my daughter's incident and seeing the crisis that our students face, I'm asking this committee to support this, because many students will eventually face emergency situations. And we can empower our schools and communities to proactively address mental health challenges and equip our students with life-saving skills, creating a safer and a more resilient environment for our communities at large. Thank you.
Thank you. Are there any questions from the committee? Okay, seeing none, thank you all very much. And that concludes the testimony on House Bill 74.